I've been jockeying back and forth between PROPE's subcommittee meetings, just left a hearing with Health and Human Services, and the topic of the day, as you can imagine, was coronavirus. And as I carry around my hand sanitizer, I actually like to ask what's going on with the VA and coronavirus specifically. Obviously, we are facing challenges associated with this, and coordination across government entities will be absolutely essential to making sure that we combat the outbreak of this virus. You know, hopefully it does not become a pandemic, but, you know, we'll, I know that everybody's working hard on this. So many of our veterans, especially our older veterans, would be at high risk for this, especially experiencing complications if it does impact them. So I'm wondering how the VA is coordinating with Health and Human Services to ensure that veterans are educated on the prevention, and then what the game plan is to what you will do in case you've got an outbreak among veterans with the coronavirus.
So we are in a position that other departments are not in. We train for this. We train not only for national disasters, but we train for epidemics. We began moving on supply chain and preparation really before this became a national issue. A case in point is the one veteran we know of who has this virus. We prepared a swath, a section of our Palo Alto campus to receive veterans who would have this virus. We set it up for that, and that veteran is being taken care of there. We have been augmenting our supply chain. We have been putting in place those courses of action that we used for Ebola and H1N1 in the past. So we will be approaching this as we have these other issues, but it is not something that is unfamiliar to us. We are in constant contact now with CDC and NIH. I'm now part of the President's Task Force. I'll have my first meeting today, although I talked to Dr. Birx at length this morning, and I'm glad that she is on board because she is someone who allowed us to turn the corner on AIDS. So Dr. Stone can give you a little more in terms of particulars.
So our team began working on this in mid-January, right after the Chinese began to reveal the problem in Wuhan. And we have been working actively, and at Traverse Air Force Base we had a team of 12 that worked to enhance the protective devices that were being used there and actually screen the patients as they were repatriated from China and Japan. One of the areas that we've recognized as we've taken the first patient from the commercial healthcare system, when that veteran who we've been talking to for a protracted length of time wanted to come to Palo Alto, was the need for negative airflow rooms. We have across our system multiple negative airflow rooms, frankly, almost 1,000. Now on any given day, about 60% of those are filled, but we begin repurposing and preparing for that. As the Secretary stated, we've expanded our supply chain and continued to work those processes. You will also hear that because we are seeing contacts throughout the nation of people that may have traveled to various areas, we have started pre-screening outside of our emergency rooms so that a febrile respiratory virus-infected patient is screened before they actually get in. This is the same method we used in influenza outbreaks, and so you'll see us either putting people through a tent and pre-screening to protect the institution. Our special concern is that we operate 135 nursing homes with over 8,000 vulnerable veterans in them, and they are on our campuses, and we must protect them. And therefore, at the risk of some inconvenience, we are screening everybody coming into the institutions. It is most robustly in place in the state of Washington, which has occurred over the last number of days. It is reaching out across the rest of the nation as we speak.